Good afternoon. We'll be doing a physical exam, patient assessment. Um, I would proper hand hygiene, knock, 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 knock.
Come in.
Hi, my name is Carlos. I'm on your nursing team, and I'm here to do a physical exam on you. So I verify the patient's identification by looking at their bracelet and asking them, may I have your name, please?
Allison Hainsworth.
And your date of birth?
12/25/70.
And this may sound like a silly question, but do you know where you are right now?
Yes.
Okay. And what date is it today?
June 6th.
So I can identify the patients that I have the right patient, and I also can check that her mental status, that she's A&L times 3, and now I can go ahead and conduct my physical assessment. I'll make sure safety precautions that all her IV lines are in order, they're not tangled. Any oxygen equipment I will secure and lower the bed to the appropriate height and lower the bed rail so that I can go ahead and perform the physical exam. So I'm going to start with a head-to-toe assessment. But I'm going to ask, I'm going to begin with the vital signs actually. So I'll do the blood pressure. I'll also attach the pulse oximeter. So I get the rate and oxygen saturation. I'll check the respiratory status, which I'll do with, I'll do that over a period of 30 seconds and multiply that by 2 and get a respiratory rate. So I can actually take care of that. Her current respiratory rate is 20 breaths per minute. Would not tell her that I'm doing that because patients generally change their respiratory rate because they know that you're taking it. Either they hold their breath or they may breathe a little faster. Are you experiencing any pain today?
No.
If you are experiencing pain, I'll definitely ask her what type. Ask her the quality of the pain. Does anything make it better? Does anything make it worse? What intervention she's done to relieve the pain? Has she ever had this pain before? I'd find out when the onset was to find out how long the pain was going on. I'd also ask her to rate her pain on a scale of 1 to 10. 10 being the worst pain she's ever had in life, and 1 being nothing much at all. So I'm going to go ahead and check her the condition of her hair, skin and nails to make sure that we have good skin integrity. At this time, I can do the scalp as well to see if we have any conditions going on. I see the skin is fine. Under the heels, especially for diabetics, and if she's wearing a robe, I could also check the rear shoulder blades, all the contact points, all the pressure points to make sure that the skin integrity is good. As I'm here, I'm going to do the head, ears, eyes, the mucous membranes, and so forth. So as before, I did check the head already. No abnormalities. I'm going to check the ears. Can you turn to me? I could also use an otoscope to do that as well. Check your eyes. Look straight ahead, please. Look straight ahead. Straight ahead. light. Pupils are equal and reactive to light, and also light accommodating. So pupils are pearly. Um, we gotta check your notes. Please open your mouth. Stick your tongue out. Open your mouth, please. Say out. See no lesions on the tongue, no abnormalities. All the mucous membranes or areas are fine, and everything like that is fine. Check her neck. I don't see any swelling to the lymph nodes or any of that. And since I'm here, I can check both extremities. Can you look at your fingers for me? Can you squeeze both of my fingers? And do you feel me touching you?
Yes.
You feel me touching you over here? So she has good sensation to, she has, hold on. She has equal pulses bilaterally. She has motor and sensory to both upper extremities, and no abnormalities seen with the skin. We go ahead and we check the lower extremities. They are symmetrical. We locate the dorsalis pedal pulse. And you feel me touching you?
Yes.
She has good pulses, motor and sensory to both lower extremities. I see no. The skin integrity is good on the lower extremities as well. So now we're going to auscultate the lungs. Can you please sit up, Billy? A deep breath. In and out, please. Thank you. Okay. So we're gonna do a posterior listen to the lungs. Breathe, please. Again. Again. Okay. Lung sounds like equal bilaterally. No sounds other than just equal breath sounds. Okay. Now we're going to listen to our heart sounds with the bell stethoscope. So we're gonna listen to the point of maximal impulse, which is the fifth intercostal space. Good heart sounds there. We're gonna listen to the aortic, which is the second intercostal space, right sternal border. And we're going to listen to the pulmonic, which is the second intercostal space, left sternal border. Then we're going to listen to the tricuspid, which is the fourth intercostal space, left sternum border. Now we will listen to the mitral valve, which is a fifth intercostal space, midclavicular line. Hearing S1 and S2 sound, which is the lub dub. So she has normal heart sounds. So we're going to go down, inspect the abdomen. The abdomen has no bulges, nothing that seems unusual. And ask if she has any pain in the abdomen before I go and palpate and then auscultate. Do you have any pain in the abdomen at all?
No.
Okay. We're going to actually need to lay you flat for this. So if you can, we're going to leave it. Okay. So if there is no pain, I'll go ahead and palpate the abdomen. First light. And we're going to start with we're going to visualize the umbilicus, and we're going to break it into the four quadrants. It's going to be right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So we're going to start with the right upper quadrant. Palpating lightly. And then palpating deeply. So we're gonna go ahead and can you rotate on your side so that I can check your back and make sure everything is well? So I'll palpate the spine at this point to see if we have any bulges, any deformities, anything. I could also look at the sacral area to make sure that she doesn't have any pressure ulcers at this time. There's no incontinence. There's no anything like that. Go ahead and you can rotate back towards me. You put your pillow under. So go ahead and ask about her bowel and bladder habits. Have you been going to the bathroom? When's the last time you had a bowel movement?
Yesterday.
And was it normal, shape, color, and that sort of thing?
Yes.
And have you been going frequently, or is it difficult?
Frequently.
Okay. And when did that start?
A day or two ago.
All right. And what about urinating? Has that been the same?
The same.
No unusual color, amount of times you go, order to it, anything, or is everything normal at that
Yes.
point? Okay. So I'd go ahead and notate anything that was abnormal, and I'd update her electronic medical record, and we'll just go from there. Well, thank you very much.